All right, everybody, we're going to go ahead and get started as people start to join. A couple of housekeeping things. This is being automatically recorded. You are muted and your video is off. So if you have questions, feel free to put them in the chat and we'll take a look at those at the end, or we'll try to answer as we go, or you can use the Q&A function as well. We have a lot to cover today, so we don't want you to lose your questions. So make sure you put those in, and we'll definitely get to questions at the end, or I have a great team with me today, so we can also answer questions in the chat as we're speaking. So after this webinar, either today or tomorrow, you'll get an email from me with the recording, PDF of the slides, and some other links that we'll talk about today. So right now, we're going to jump right in. On your screen, you see some of the beautiful baby faces, some of the babies that we know have been saved with Count the Kicks, our evidence-based stillbirth prevention program, which you're going to learn more about here in the next 60 minutes. And we're so thankful and grateful for your time today. My name is Megan Ockett. I am the program director at Healthy Birthday, which is the nonprofit organization that created Count the Kicks. I have been with the organization for about 4 years. My background is in public health. I have been in public health for about 15 years. I absolutely love prevention, empowerment, and education, especially around systems change. So for my role today, what you'll hear me talk a lot about is the research and evidence, but also how you can integrate Count the Kicks into your workflow, whether you're WIC, home visitor, a health system. It's all very similar and easy to do. And so I'm really excited to share that with you today. With me, I have some amazing individuals on our team, and I'd like them to introduce themselves. So I'll start with Sam. Oh, did we lose Sam? I'll start with Nneka. Go ahead, Nneka.
Hello, everyone. My name is Nneka Hall. I'm the mom of 4, 3 who are with me and 1 who rests in paradise. I found Count the Kicks in early 2021, and followed them and invited Count the Kicks to an event that I was hosting. And even though my daughter Anaya was stillborn, Anaya is the reason why I became a maternal health advocate. But I became an ambassador for Count the Kicks after I heard them say, the presenters say, that in their first 5 years, I think it was, or was it first 10 years?
5 years, yeah.
First 5 years, an all-white staff was able to decrease Iowa's stillbirth rate by 32%.
The African-American rate by 39%.
Right, but the whole, overall.
Yeah, that was 10 years. Yep, 30.
Yes, 10, okay.
You're right, you got it.
But I was amazed when an all-white staff was able to decrease the Black stillbirth rate in Iowa by 39%, and it has increased even more ever since. That sold me, and I said, well, if they did that without intention, without directly reaching out to the BIPOC members of their communities, then imagine what we could do together with intention. So I was sold. I'll shoot it over to Sam since I see that she's here.
Thanks, Nneka. Sam, would you like to introduce yourself?
Actually, I'm going to go off video just because internet is unstable on my end, sadly. So hello all, Samantha LaCroix, and I am a mom to 3.
Sam, we're losing you. I'm sorry. Is it okay, Sam, if I share a little bit about you?
Yeah.
Okay. Apologies for that. Sam is another one of our Massachusetts Count the Kicks ambassadors alongside Nneka. She is a mother to 3 children. Xavier was born still in 2012, and this is her why she does this is for Xavier, and I'm really fortunate to be alongside these women, even though their circumstances are tragic, and this is why we do this. This is why we have these hard conversations is so that others don't have to endure the loss that they did. So we're so grateful for NECA and Sam for sharing their stories, for being brave and being with us today, and doing this in honor of their children. So thank you all for participating. And with that, I'd love to throw it over to Dr. Yazdi. Go ahead.
Good afternoon, everyone. I'm really glad that it's 70 degrees here and not 112 from where you just came from, Megan. My name is Masa Yazdi, and I'm the director of the Center for Birth Defects Research and Prevention in the Bureau of Family Health and Nutrition here at the Massachusetts Department of Public Health. I'm thrilled to be here today and join all of you in this collective effort to raise awareness of stillbirth prevention, especially for families who have been historically and traditionally marginalized and affected by stillbirth. We are proud to be part of this partnership to launch this evidence-based stillbirth prevention program in our state. Each stillbirth represents a profound loss and a heartbreaking moment for families who should be celebrating the arrival of their precious newborn. Unfortunately, our stillbirth rate in Massachusetts is at 4.2 per 1,000 live births. We believe that we can lower that rate by working with you, Healthy Birthday Inc., and our incredible network of maternal health providers, birthing hospitals, social service agencies, home visitors, and childbirth educators to empower expecting parents with the knowledge, skills, and tools from Count the Kicks to help all families have a safe and healthy pregnancy, regardless of their race or background. And we heard NECA share some of those statistics that we've seen in other states. The power of Count the Kicks lies in its simplicity and effectiveness. By educating expecting parents on how to track their baby's movements and become attuned to their patterns, we can help identify potential issues and help families take proactive, potentially life-saving measures to ensure the well-being of both the mother and the baby. I encourage you all to spend the next 60 minutes listening and learning and implementing what you learned today in your organizations. With the success of Count the Kicks across many other states, we hope to see the same success and continue to partner together to promote accessible and equitable prenatal care policies and systems and save more babies from preventable stillbirth. Thank you all for being here today and for your passion and commitment to serving families across the Commonwealth. Let us continue working together to create a healthier and safer environment for all families and ensure that every baby has a chance at a healthy and vibrant life. Megan, I'll pass it back to you.
Thank you so much, Dr. Yazdi, for those wonderful words. We are so grateful for this partnership with Massachusetts Department of Public Health. It's because of this that we're doing webinars like this today. And so we are just grateful for this partnership. We look forward to expanding this work and connecting with you all, because you're the grassroots, you're the boots on the ground. You all are going to make that stillbirth rate decrease in Massachusetts because of the work that you're going to do from what you learned today. And so with that, before we begin, let's watch how Count the Kicks helps save lives.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
Go ahead, Decca.
So looking at baby Ruby and looking at our statistics and our data from across the US, we could possibly save 91 babies in Massachusetts by using Count the Kicks each year. And meet beautiful, beautiful baby Wendy. Baby Wendy is a Massachusetts baby save. And she was saved because even though we did not at that time have this app here, Mom's friend from Iowa told her all about Count the Kicks. And because she counted, Wendy is here. So let's take a look in the beginning about our definitions and our facts. Well, a miscarriage is usually defined as the loss of a baby before a 20th week of pregnancy. Still, a stillbirth is the loss of a baby after 20 weeks of pregnancy. On average, there are 22,300 babies born still every year in the United States. The death of an infant before his or her first birthday is considered infant mortality. And on average, around 20,000 infants die every year in the US. We would love to highlight the fact that the highest number is within all of these would remain to be stillbirth. So let's take a look at stillbirth by the numbers. Families are 6.5 times more likely to lose a baby to stillbirth than to SIDS. 1 in 173 pregnancies end in stillbirth, and racial disparities still do persist. Native Hawaiian or other Pacific Islander pregnancies, 1 in 94, Black pregnancies, 1 in 97, Indigenous, 1 in 128, Hispanic, 1 in 205, White, 1 in 211, and Asian pregnancies, 1 in 254 babies are born still. 4.2 stillbirths per 1,000 live births take place. 285 babies are born still every year in Massachusetts. And we could really lower that number by using this life-saving app. So why are these disparities happening? Why are these birth outcomes the way that they are? Well, research identifies the following: systemic racism, or the way that society fosters racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, media perception, healthcare, and criminal justice. Epigenetics explains how early experiences, both positive and negative, can have lifelong impacts. Environmental influences can affect the expression of genes. Life experiences can rearrange the epigenetic marks that govern gene expression. They can change whether and how genes release the information. Predisposition to certain conditions that may lead to stillbirths, like gestational diabetes and preeclampsia. Access to healthcare can impact diagnosis and treatment of concerns. Socioeconomic barriers. Research shows that education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. Let that sit with you for 1 second. So we have all of these wonderful resources within the Count the Kick model. As you can see here, we have bracelets for those who may or may not have access to to technology. We also have paper charts, and we'll talk more about those later. Our app is in 16 languages. We do have social determinants of health surveys, and we utilize everyone including non-traditional providers such as doulas, childbirth educators, community leaders, etc., to come in and reach their demographic, their population.
Thank you, NECA. Now that you have some of the data in the back of your mind, let's highlight the fact that this is research and evidence-based. And I'm going to go into some of the research studies and the evidence behind Count the Kicks, because it's always one of the top questions. So when we think about Count the Kicks, what I want to highlight is this Norway study. So we were founded off of this study. We were founded by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time of their loss. They got connected through friends and pastors. And as they started connecting and grieving and meeting for coffee, they said, this is a lot more common than people think. Here we all sit, 5 low-risk pregnancies, and we all experienced similar situations around the same time period, yet we were told things like it was like getting struck by lightning. It was like winning the lottery if the lottery was negative. I mean, who would say that? So these founders, long story short, a couple of them were at a public health conference in the early 2000s. At this public health conference, they heard some researchers speak about a study out of Norway that showed when expectant parents were educated on getting to know what was normal for their baby in the 3rd trimester, that the stillbirth rate among this cohort in the study decreased around 30%. So the founders heard that and said, that's amazing. Kit County's been around for a long time, but the tools and resources to be able to, one, talk about stillbirth in easier and more empowerment advocacy way, and the tools and resources for expectant parents to feel empowered and to speak up to their provider, that hasn't been created. So let's come back to Iowa. Great things start in Iowa. Let's come back to Iowa. Let's look at some additional research, work with our Iowa Department of Public Health, and create this empowering evidence-based campaign. And that's what they did. It's bright, it's colorful, it's empowering. So if you're really into reading research and journal articles, awesome. We have a whole evidence page on our website where you can read this study. You can read lots of the other studies on fetal movement monitoring, but this is the one that started it all. And this is why I like to highlight it. We also have Dr. Ruth Fretz, who was the only United States researcher on this study, and she is in your backyard. She might even be on today. So hi, Dr. Fretz, if you're on. She is also part of our medical advisory board now. She was part of this Norway study that showed this decrease when women were educated on getting to know what's normal for their baby. And this is what we replicated in Iowa and now in states across the United States. We have other evidence that's been published that I wanted to highlight for you today as well. We were recently published in the BJOG, the British Journal of Obstetric Gynecology, on our evidence and on that 32% reduction that NECA talked about earlier. The researchers found that in Iowa's stillbirth rate from 2008 to 2018, which was the time period they studied, that the stillbirth rate decreased 1% every 3 months. So you can read more about that evidence and research in BJOG. And then we also had research published in AJOG that talked about our app and how the app helps increase bonding and decreases anxiety. And I'm going to talk about that here in a little bit. So this will all be sent to you. You can scan these QR codes once you get the PDF. We have great videos that talk about the BJOG research too, short, easy videos, so that if you're not into reading research, you can watch the videos of our researchers talk about it and hear some of the highlights from it. So in graph form, this is what that 32% reduction looks like in Iowa. So we launched in 2008 where that line is, and you can see we've had that downward trend since then. There's a couple outliers out there that you can see, things like a syphilis outbreak, a pandemic that things like that impact the stillbirth rate. But what we want to really pay attention to is that dash line, that trend. This is the type of trend we want to see happen in Massachusetts, but we need your help, right? We have the potential to save 91 babies from preventable stillbirths. That's 32%. We could do more than that, right? So let's work together to decrease the stillbirth rate in Massachusetts. Like Nneka mentioned earlier too, in the first 5 years of the campaign, we saw a 39% reduction among the African-American stillbirth rate in Iowa. So this is the type of evidence and trend that we want to see happen in Massachusetts. And this is why we're so grateful for you, for the Department of Health, to invest in this and to show this does work and this can work. And it's because of you all on this call today, it's going to make the most impact. So how did we get to that reduction? How did we get to that 32% reduction? We inundated Iowa with our educational materials. We have posters, we have app reminder cards, we have brochures in English and Spanish. And thanks to our partnership with the Massachusetts Department of Health, and previously Nneka and her organization before that, these materials are free for you in Massachusetts. So one of my favorite parts of this presentation is I'm going to give you time to order these materials. You're at your computer or you're on your phone, go to counttthekicks.org, scan the QR code, order materials. I'm going to play this song because it's the middle of the day on a Thursday. Come back, order your materials. You'll be entered to win a gift card, a $25 gift card to Amazon. So there's no reason not to. They're completely free, free shipping. Take 2 minutes, go order the materials that you need between brochures, posters. Come back and we'll continue the conversation to talk about a little bit more evidence. So we'll get this song playing here. If one of my colleagues, if they haven't already, go ahead and put the website in the link so it's even easier in the chat.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you.
All right, I know we can multitask, so I want you to keep ordering because remember, you're entered into a drawing for a $25 gift card to Amazon. But I also want you to take this time, we're giving you this time to order these materials that will help you share this information with the expectant parents in your area. And who doesn't love Pharrell Williams and that happy song? It's just a feel-good song. And I'm happy that you're taking time to join us today. So with that, we'll keep going on so we can be cognizant of your lunchtime. The other thing I wanted to talk about as you're ordering, remember we're multitasking, so keep ordering, is the fact that talking about fetal movement monitoring, talking about Count the Kicks and the importance of tracking babies' movements does not have adverse effects. I think that's one of my top questions I get is this going to increase visits to the doctor, to the emergency room? Is it going to increase calls to my nurses? Isn't this just going to increase the anxiety of my patients? And I think as individuals and humans, we have a tendency to almost go to that worst case scenario, right? And I'm here to tell you that doesn't happen. There's no increase in hospital utilization. There's research out about this. And this research study that I highlighted here says usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And I'll tell you why in just a minute. On the flip side of that, the app actually helps decrease anxiety, and we have research on that as well. 84% of our thousands of app users that we studied stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. And the reason why is because now they have data. They have a data download of their intuition that they can show to their provider and say, look, this is not my baby's normal, I need to be seen. Or look, this is my baby's normal, I want to talk about this so you know that I'm doing this. So it gives data in their hands to be able to share with their provider and know when to go in and then how to go in and how to talk about this with their provider. So those are some things that I like to highlight as well. And then I also like to highlight the fact that I think, again, we go to that almost worst case, emergency C-sections. This is going to increase the C-section rates. In Iowa, that has not happened. We have not seen an increase in the C-section rates. There's also added benefits that I think we tend to glaze over that I wanted to highlight. Things like reduction of preterm birth, fetal growth restrictions can be identified earlier. We also know that women who have stillbirths are at a substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So this study here stated, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. Because when you do come in with a change in fetal movement, you're doing those additional tests, right? You're not just saying, yep, automatic C-section. It's a way to check on baby. It's how baby communicates with mama, with parent in utero. And Sam's going to talk about that in a little bit. I mentioned that connection between maternal mortality and morbidity. We know that you're 4 times more likely to die if you have a stillbirth. And one of the things that we did last spring was we worked with some researchers and drafted a white paper on this connection. And what we did is we highlighted stories, Count the Kicks app users who not only saved their baby's life, but also their own life, because when their baby's movement changed, that also indicated an issue with them. So you can read more about this white paper on our website. It's there for public. It's in English and Spanish. It just goes into that evidence pile of why this is so important and needed, and it's so low cost. It's non-invasive. Why wouldn't you have this conversation? Why wouldn't you share this with your expectant parents in your area? So with that, I want Sam to kind of go into the meat of Count the Kicks and what it is and things like that. So go ahead, Sam.
Awesome, wonderful. Thank you so much, Megan. As Megan was sharing just a little bit about why I wanted to take a hot second and say that my firstborn son, Xavier, was stillborn at 40 weeks, 3 days after I went to my 40-week appointment. And at that appointment, I was asked, how am I feeling and how is baby? And I said, we're fine. He's just not moving that much, but he must be running out of room. And I dismissed it. The nurse noted it, but it did not raise any flags. And so I was told to come back in 3 days for my MFM appointment. And that's when I learned that my son had died. I was at a top tier hospital with an amazing team of OBGYNs right in downtown Boston, Longwood Medical, perfectly healthy pregnancy. And I knew nothing about kick counting. I knew nothing about the importance of fetal movement monitoring. So that is my why. And I love that this app specifically was created to be mom-centered, right? So this is designed to meet mom and parent where they're at for them to engage with their baby and learn their baby's normal. It is evidence-based. So again, it's making sure that a parent learns to track baby's movements pretty much same time every single day. And you learn that normal for your baby. So some babies may move 10 times in 10 minutes, whereas some babies may move 10 times in an hour. It doesn't matter. It's what's normal for your child and getting in tune with that. And if a mom ever notices a change in movement, that is when she should speak up and say, you know what? My baby's movements have shifted and changed. And that's a reason to take a look at mom and to take a look at baby and see how they're doing. And there's data to back it up. It's not, I feel, maybe, I think. No, I can show you on the app exactly how my baby's movements have changed, either in frequency or in strength or other. So why does movement matter? Movement really matters because, as Megan said earlier, baby's movement, this is really their only way to communicate with us while they're in utero. And they let you know when they like something, when they don't. You hear people talk about listening to music and noticing a change in baby's movement when they're listening to music. They respond to these things through movement. And just like you or I, if we're not feeling well, a lot of times what we are going to do, I know I do this a lot, I want to just curl up on the couch or lay down in bed and rest. I conserve energy. That is the first thing I really am doing if I'm not well. The same thing is true for baby. It is an indication that something is not quite right and you should have baby checked out. And sometimes that can be the only warning sign that a baby gives that they're in distress. And I just wanted to comment that baby's heartbeat, that can be the last thing to go. At my 40-week appointment, Xavier's heartbeat was strong. It was great. So ACOG, says that when should you start counting? Most pregnancies, you're going to start counting at your 28 weeks of gestation. If you're considered high risk or you're pregnant with multiples, to start counting at 26 weeks. And that, this is really when research has indicated there's an established routine or pattern to baby's movement that mom can really start to feel and track. As I alluded to earlier, in terms of movements, this can be anything from rolls, kicks, jabs, the swishes, the pushes, anything except a hiccup, really, because that's an involuntary movement, would count as movement. And I do like to say you should also, moms should be paying attention to the strength. Was that a really strong movement or was it a sort of soft flutter, and gauging all of that. So the app itself, this is free. You download it onto your phone, as Megan said earlier, or I think actually it was NECA, this is available in 16 languages. So it really is accessible to expectant parents. It can go on any platform, Android or Apple. And really, you start your session each time and you can tap through and note. So you see the little foot and the darker teal, that just sort of counts each kick as you tap the foot. And as you finish each session, it logs the time it took to get to 10 minutes, and you start to see a chart or a graph of what that history of movement might look like. Now, again, to make sure that it's accessible, I talk about it as an app on the phone because I think that's how so many of us these days interact with technology, but obviously there's also compatibility with Apple Watch. You can do it through a web-based kick counter that would link to your profile that you can create online. And there is also a printout version. So if someone doesn't have access or isn't comfortable working in a digital forum, they can have that physical piece of paper that they start to track and monitor. Again, it is free. And I think that's wonderful. There are no ads that pop up, so people don't have to worry about all this spam coming through. It's really phenomenal. And again, because this app, once you create your account, you can actually share it with your care team, with your provider, so that they can see and start to learn what your baby's normal is. And I think, again, that it creates a stronger partnership, I think, between mom and physician's care team, because they're sharing that information, they're sharing the data, they're seeing what's going on with their patients, right, with mom and baby. And then if there is a change, everyone sees it, everyone knows. And it just really helps to validate and support moms advocating for the well-being of their baby and of themselves.
Yeah. And then Sam, I'll just add to one of the big takeaways here for you all. Well, two things. One, I put in the chat, go ahead and download it right now. Like, we want you to download it and use it so you can see how easy and user-friendly it is. So you can pull it out at your next appointment with your parents and say, look, have you heard about this app? I want to talk to you about this. I want to walk through how to do this. Let's set up an account together. Or you are a clinic and it's their gestational diabetes test. I always had to take my lovely drink in the waiting room and wait there for an hour to get my blood drawn. What a perfect opportunity to say, here's a brochure, download this app, and then let me know what questions you have. Let's talk about it. The other thing I wanted to highlight and really, really stress is the fact that You can set daily reminders in the app. So they don't have to go out into their calendar. They can do it right then and there. So choosing a time when baby's most active, what works for them, when baby's, maybe it's 2 o'clock in the afternoon when they have a 15-minute break at work. Maybe it's 9 o'clock at night when they can finally sit down and focus on baby. The most important takeaway is that they need to do it daily around the same time each day. That is how they're going to get to know what their pattern is, what's normal for their baby. So those are just 2 quick things I wanted to highlight as well.
Thank you. This just speaks to Count the Kicks and Healthy Birthday, and really looking at the individual as a whole and taking care of their well-being. Through the app and also online, we provide access for moms to find local resources, providers in their area that could help them in their journey, right? So this is looking for any kind of free or reduced cost providers, care teams, supplies, resources, that sort of thing. They can type in the zip code and up will come a list of resources in their area that they can access. So again, if this was looking at WIC or dental care, whatever it might be, local resource.
Yeah, thanks, Sam. So you learned about the app, you have the data. Let's talk about how you have this conversation and how you implement this in whatever work environment you're in. But first I want to highlight how we're improving our health literacy by having these conversations. We know that health literacy is so important, and you are improving the health literacy of the expectant parents you work with by having these types of conversations, because you're being equitable, you're avoiding assumptions, and you're providing all expectant parents, no matter their race, their gender, their religion, their socioeconomic status, sexual orientation, marital status, educational level, the same information and every interaction. You're doing the same exact thing. You're listening and you're learning. You're asking strategic and open-ended questions about kick counting to help you assess what the individual patient understands, feels, and desires. When I was 20 weeks pregnant with my first, all I was asked at 20 weeks was, have you felt baby move yet? That was it. That was the only time I was ever asked that. And I was like, I don't know, should I? I was a first-time mom. I knew about Count the Kicks because of the sign on in the waiting room. Like, that's how I learned about it, knowing that I should be tracking my baby's fetal movement. We need to have these open conversations. It should take 3 to 5 minutes every single time you see them, whether it's at a doctor's appointment, a WIC visit, a home visitor appointment, a librarians order this all the time. Anybody can talk about this, and everybody should be talking about this with expectant parents. You're being clear and concise. You're avoiding long or complex explanations and medical terminology. So today we're talking to you, we're using terms like fetal movement monitoring. I wouldn't do that if I was doing a presentation to expectant parents at a baby shower or something like that. We talk about, what's your baby's movement? What do you feel, those pushes, those jabs? What questions do you have about your baby's movements? That's the type of terminology I would use. But you're also being honest. You're speaking the truth while still practicing empathy and compassion. Nneka is going to talk about more of that conversation and talking about stillbirth with expectant parents next. But I wanted to highlight too, you're reteaching. If the patient displays confusion or lack of understanding, make sure to correct and clarify. You're providing extra support to those who need it. It's just like when I was asked at 20 weeks, I obviously was like, I don't know, should I? That would have been an opening. In 20 weeks, yeah, you start feeling those flutters. But again, I should have been talked to about this starting at 28 weeks every single time in my 3rd trimester. So you're providing that extra support. And I want you to talk about this at every single time you see them. I want expectant parents in Massachusetts to see this on social media. I want their provider to talk about it. I want them to see a brochure in their waiting room, and they want to see a poster in their bathroom. I want them to see things in their library and community-based organizations. And then I want you to talk about it at their WIC and home visitation. The more opportunities we share this, the more common practice it gets. Go ahead, Nneka.
And we always have to remember that a provider's influence on expectant parents is strong, and they need to hear from you. Mm-hmm. They need to hear from you about why tracking fetal movement is important. There are always all of these touch points that we miss. We need to be talking about it with each other. We need to be talking to them as doulas, as childbirth educators, as community health workers, as OBGYNs, midwives, advocates, etc. Insert title here. You need to be talking about this, and it's not going to cause anxiety. Anxiety comes from and remains with you when you are a mom of a baby who's not here. So if you're worried about scaring them, don't worry about that. I would rather them be a little concerned, be a little hypervigilant, than to worry about causing anxiety, causing issues, causing whatever, because at least their baby will be here. Sam, did you have something to add?
Yeah, I was gonna say, because my first was stillborn, and I didn't know about the importance of fetal movement monitoring. I actually, in Kit counting, I didn't learn until after I had my son Oliver, who is just about 10, and after I had my daughter Lillian, who is now 6. And I went through both of those pregnancy, high anxiety, with late night drives to Beth Israel at like 2 in the morning, because I'd wake up and I'd go, I don't feel them moving. And so anxiety, and I'd go, and L&D would be gracious and get me hooked up, do an NST, make sure everything was okay, and then send me on my way. So again, talking to parents about this, I wish I had known before Xavier, 1, 2, in subsequent pregnancies, known about the importance of Kit counting.
Right. And I'll just add really quick to Nneka and Sam. We talk, you know this, Nneka, especially as a doula, we talk to expectant parents about all sorts of things in our pregnancy. Take a prenatal vitamin, don't eat the cheese, don't eat the lunch meat. I was so scared to eat lunch meat, and I was so scared to eat soft serve ice cream out of the McDonald's thing because I thought it had listeria, because that is what we hear. That is what we hear. And listeria accounts for like 0.0001% of deaths. You know, it's still tragic, but it's so minor. But there's a whole protocol about listeria from ACOG. Like, we should be talking about this just like we're talking about prenatal vitamins, not drinking, everything like that. So go ahead, Nneka.
There's so much that we talk about diabetes. We talk about weight gain. We talk about all of these things. Why not talk about things that can save not only their babies' lives, but preserve their lives as well? Because you cannot undo or unsee a loss. You really can't. So when we look at, I don't want to scare expectant parents, pregnancy is full of risks that we talk to expectant parents about. Stillbirth is another risk that expectant parents deserve to be educated about. Stillbirth just happens. There's nothing we can do. Well, there are warning signs in most instances. And if parents know what to look for, I made it to 39 weeks. Sam made it to 40 weeks. We thought we were done. We thought we were going to bring our babies home. I found out at my 39-week checkup. I'm sorry, there's no heartbeat. It happened recently, possibly while you were still here. And Anaya was my 3rd child, so I expected to hear at that appointment anything and everything except for what I heard. I'm sorry, there's no heartbeat. My baby is always active. It's not a concern. Well, babies are active until they're not. Cord and placental complications can be sudden. Expectant parents need to know what's normal so they can notice a change. And as Sam and I have proven, I'm almost at my due date is not. No, you can be right at the door. Baby Wendy was days away from her due date. Mom was days away from her due date when baby Wendy was saved. Mm-hmm. If Sam and I had had access to this app, if someone here in Massachusetts at Sam's office or at Mass General Hospital where I was had told me at 28 weeks to start counting because I needed to know this could save my child's life, I would have used the app, but I did not know about it. until years after I lost my daughter. So remember that the risk of stillbirth increases as an expectant parent approaches or exceeds their due date.
Yeah, and before we go into a couple more misconceptions, there was a question in the chat about the app and providers in Iowa. And actually the app came out in 2015. Before that, it was web-based for a little bit, but really it was the materials. We saturated OBGYNs and midwives with the materials. It's that public awareness, right? And then when the app came out, yes, that's a tool, right? You don't have to have the app. It's a great way to track it and have data in your hands. But like Nneka mentioned earlier, or Sam, if you have people that maybe don't always have Wi-Fi and they can't use the app, we have paper kick counting charts. The really important thing is sharing this message and sharing that you should be talking about fetal movement monitoring with your patients so they know what to look for and get that average amount. The app does that for them, which is why it's so nice. But really before that in Iowa, it was just spreading the awareness, spreading the message and things like that. So I wanted to address that question while it was in the chat. But Nneka and Sam have some common misconceptions that I think they would like to share with you all, including the one we talked about, the active one. Go ahead, Nneka. Oh, you're on mute, sorry.
So my baby's always active, so I don't need to count kicks.
So as we've talked about, even active babies can experience distress and sometimes quickly with or without warning signs. So really tracking your baby's movement daily takes the guesswork out of knowing if it's normal or not, then if that normal activity is slowed down. So again, Count the Kicks gives you data to show your healthcare provider if you have a concern.
Yeah, and Dr. Fred, so again, I don't know if she's on, but she always said a healthy baby is an active baby, and I love that, you know, and that's what I tell, because you'll get this a lot as you go out and talk about this. Oh, I don't need to do that. It's like a jungle gym in there. I get it. I've had 3 pregnancies. My son was 5 minutes or less. My daughter took 30 minutes or less, and I was always comparing her to my previous pregnancy. I went to triage 3 times with her. I just didn't understand that was her normal, and so it's really important to take that guesswork out of knowing if your normally healthy active baby has slowed down. That's where this can come in and help with that.
Only those experiencing a high-risk pregnancy should pay attention to their baby's movement.
And this is where really, no, that's not true. All expectant women should be educated on kick counts and get to know what's normal for their baby.
Right, because neither of you were high risk, is that correct?
Correct, until my subsequent pregnancies.
Right.
And even that was not informed.
Right.
My baby should get 10 kicks in 2 hours.
I hate this myth. It's big fat lie. Every baby is different. And really it's the recommendation that you should expect the recommendation of 10 kicks in 2 hours is really outdated because again, every baby is different. And so you need to learn what's normal for that particular pregnancy, just like Megan mentioned, right? Same mom, 2 different pregnancies, 2 different windows for getting to 10 kicks, but normal for each of those pregnancies. And that's the key. Just like you or I respond to things differently when we're not feeling well or when we are feeling well. Like I have friends that can go run 5 miles every day, no problem. Whereas that's not me. I'm not that high energy. So again, every baby is different. Learn what's normal for them to get to 10 kicks in a day.
Yeah, and we also have research on this on our website as well. And basically what it says is, as humans, we focus so much on the time. Like, you know, I have 11 minutes left of this presentation, right? You have 11 minutes left to listen to us speak about this wonderful initiative. But so 10 and 2, when we think about that, and when you're telling somebody that, or 10 and 1, they're so focused on that time, right? So they could be counting every day for the last 2 weeks and get 10 movements in 15 minutes. And one day they count and they get 10 movements in 1 hour and 15 minutes. And they think to themselves, well, that's okay. I was always told I should get 10 movements in 2 hours, so my baby's fine. But that's not my baby's normal. My baby's normal for the last 2 to 3 weeks has been 15 minutes or 20 minutes, not 1 hour and 15 minutes. So you can see, and that's what that research states, is it's all about getting to know what's normal for your baby. That's why it's so important to count daily. Here's another one. Common.
I can just use a Doppler device to monitor my baby's well-being.
Again, false. You know, a change in a baby's heartbeat is one of the last things that happens when a baby's in distress. And really a change in baby's movement can indicate potential problems before the heart rate changes can be detected. So this is where, again, expectant parents really should only be using a Doppler device under the guidance of a healthcare provider. And even then, I would say that's not the reliable, like, oh, everything's fine, heartbeat strong. Because as I said, my 40-week appointment, Xavier's heartbeat was strong. Head down, measured my belly, everything looked great. I was fine based on, you know, taking my blood pressure, right? So movement is really key, not the heartbeat to be paying attention to.
If baby isn't moving, I should drink something cold or eat something sugary to get the baby to move.
False again. You know, research has really moved away from the idea that sugary drinks are a good way to get babies to move. Really what you want is you want to know baby's movements without interventions, right? So don't give your kid a bunch of sugar to see if they can, you know, learn how to walk and go across the room. Let them do it on their own, right? Do they have the energy and the strength to do it on their own under normal circumstances? And again, if babies aren't moving like normal, what they've learned is normal for their baby, then the parents should be speaking up to their provider right away.
Babies kick less near the end of a pregnancy.
So this is the false conception that I fell prey to. I thought Xavier was running out of room. And so that's why I thought he was slowing down, and that is not true. While the types of movements can change, there may, you know, can change. Babies move up to and even during labor. And it's funny, I actually remember this with the delivering my daughter. She was moving all the way up until the minute she came out, and she hasn't stopped. So again, you know, if a parent is monitoring their baby's movements at the same time each day, they know it should take about that same amount of time to feel the 10 movements. So again, like Megan said, if the normal is 15 and then one day it's an hour and 15, that's a signal that something has changed. You should get checked out.
Pregnant people should avoid dental care.
Another false one. So again, good dental health is obviously always important, but pregnancy can increase expectant parents' risks of dental issues and overall health issues. Yeah, I won't go into a narrative there.
Triage doesn't need any Count the Kicks education.
False. Again, this is actually, I think, one of the best places to have this information. Again, I wish L&D had it at Beth Israel when I went in with Oliver and when I went in with Lillian, because I could have gone home with reassuring information on how to learn my baby's normal to know what's normal for them, and then know when I should speak up versus thinking, oh, it's 2 a.m. and they're not moving. So again, when I was discharged, they could have sent home some information on kick counting at that point in time, and that would have been fantastic.
So as we wrap up, I hope you've been thinking about how you can integrate this into your system, whether you're a health system, WIC clinic. The first step is obviously ordering the materials to have available, ensuring everybody on your team knows about Count the Kicks. We have this recorded, so be sure to share the recording. Include Count the Kicks in your paperwork. We have after visit summary gold standard practice, things that we can share with you. I'm happy to have more conversations with you. Include it in phone recordings, action plans, family care team meetings. There's so many ways you can easily integrate this so you don't forget to ask about it. Discussing at every parent meeting. If you're WIC and it's you discussing, you know, they're 24 weeks and you're not going to see them again until 30 weeks, go ahead and start having that conversation at 24 weeks and say, hey, I'm going to hand you this brochure. I want you to download the app. I want you to start counting as soon as you hit 28 weeks. And then I want to talk to you about it at your next appointment, and be sure to talk to your provider in between there too. So sharing throughout the community, I cannot stress this enough. You are the change. We are better together. I'm in Iowa. You all are the boots on the ground in Massachusetts that are going to make this change. We're just giving you this information, and you're the ones that are going to implement it. So feel free to reach out to us with questions. If you want some after visit summary form, verbiage, anything, we're happy to help. We also have an online CE training that you can take. It goes into a lot more detail. You actually get to read the Norway research and answer questions on it. It's 2.25 CEs. We'll send that link as well. And then again, I just wanted to highlight the fact that thank you to the Massachusetts Department of Public Health, that the education is free, and for NECA prior to that, for her work at Mother Supreme, the materials were free as well. And so you have posters, app reminder cards, magnets, and things like that. You'll be getting those magnets, sorry. And then the paper kick counting charts. And then Sam, would you like to close up for us?
So I love this. This is actually a baby save that just came in earlier this month. And I'll try and paraphrase as much as I can what happened here. So this is baby Brody. And here's a little bit about what his mom shared with us. So our family was excited for the arrival of our second child, a baby boy named Brody, who is due to arrive in early June. I had learned about Count the Kicks during my first pregnancy from my doctor's office. Throughout both of my pregnancies, I was encouraged to learn the normal movement pattern for my babies and strongly encouraged to speak up about any concerns that I may have. During my pregnancy with Brody, it was discovered that antibodies had developed, small c in my case, increasing risk for hemolytic amnia for Brody. And so they had already planned to deliver and induce him at 37 weeks. She received weekly non-stress tests and ultrasounds to check on Brody's well-being. And at her 33-week gestation appointment, Brody passed all tests with flying colors. Here's the key part. The next morning, she says, I noticed I didn't feel him move like I normally did. It was a night and day difference from the day before. Something did not feel right, so I called my doctor and went in to get checked right away. When I arrived at the hospital, they took my concerns seriously, performed another NST, which did indicate some movement, but they were soft and she couldn't feel them. A biophysical profile was performed and Brody only scored 2 out of 10. He had passed this exact same test less than 24 hours earlier with flying colors. So this is, again, change of movement. This is an acute condition, similar to if you were bleeding or experiencing sharp pains, right? So after discussions with the doctors at the hospital, they decided, yep, got to get an emergency C-section. He was born less than 5 hours after she identified his lack of movement. When he was born, he did have to go to the NICU and did have to have a minor, a surgery shortly after being born. But he is healthy and home with his parents today because mom noticed a change in movement and spoke up. And so that was from Hannah, Brody's mom.
Yep, and then finally, we're going to end on one other high note, and then we're happy to stay on and answer any questions that you may have. But this is baby Nala's story, so let's watch.
She came back in after she had me put on the monitor and stuff, and she's like, we're just going to take her. And I'm like, what? And she's like, her heart rate is dropping every time you have a contraction. I was already scared, because I was a high-risk pregnancy. I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, That was what I lived for, just because I wanted her to, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. she thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself, don't feel bad or stupid, don't worry about insurance or the emergency room bill, go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously, like, it's your baby's life.
I like what she says, where she's like, you know, don't worry about this, don't worry about that, just go check on your baby. And this goes for, we didn't really talk about it today, but those rural areas. I know Massachusetts has a lot of rural areas too. So if your expectant parents have quite a drive to their nearest birthing center, they can't wait for the family physician to open the next day. They need to go get checked out and make sure everything's okay. I saw somebody ask about social media. Feel free to share any of our social media. We have YouTube videos that you can share. They're on the app as well. Or if you want us to share Count the Kicks information on your website, reach out to me. I'll put my information on the chat and you'll get an email. But we can do simple things that you can share information on your websites to share with your parents as well. I know we're 2 minutes over time, but we are happy to stay on and answer any questions. I'm just so grateful for NECA and Sam for sharing your stories today, for being part of this in honor of your babies. Just thank you from the bottom of my heart. Thank you, Dr. Yazdi, for being on. Thank you to the Massachusetts Department of Health. We're just so grateful for this partnership and for you all for joining us today. This means the world, and I know it means the world to Sam and NECA to see all of you here. So I see a lot of things going on in the chat, so I'm just gonna double check that we didn't have any questions. And feel free, Sam and NECA or Dr. Yazdi, if you'd like to say anything else. I'm just checking the chat quick.
Well, Sam and I are here. Please reach out. We want to hear from you.
Mm-hmm.
Let us help you get this information into the hands that need them. Let me know, let Sam know, reach out to Megan, reach out to Dr. Yazdi, and any of the team so that we can make sure that we continue to save lives together.
Yes. I'll put NECA and Sam's email in the email that will go out, so you'll all have access to them. And then Angela, yep, I'll share that with you. Somebody else asked something. This costs nothing, it makes it, oh, yes, thank you so much. This is, yeah, the state has made the materials free, the app is free, like there's no reason not to do this, right?
Exactly. And I was going to say, just to NECA's point of, you know, we're here in the state, we are available, we are happy to help out. You know, NECA's in the Boston area, I'm over in the Worcester area. Our state is not that big, so happy to, you know, connect with people either virtually again, or if there's an in-person event where you're like, I would really love the opportunity to have one of you come, feel free to reach out to us. If we can help the effectiveness of this campaign, that's what we're here for. Because we don't want anybody to experience the loss that we've gone through. So help us honor our babies and make a great impact in this state by saving future families from experiencing this kind of loss.
Yep. Yes, Betty, it's only in English and Spanish. The brochures, posters, and app cards. Sorry, that was an error on that slide. But yep, those are the materials, and we're talking to the state about some additional pieces as well. So look for that soon. Thank you all. All right, I'm gonna close out. Expect an email from me, and I hope you all have a wonderful 60, 70 degree weather day. Bright, sunny Boston, Massachusetts area. Yes, Irini, yep. Thank you all. Have a great day. Thanks, NECA. Thanks, Sam. Thanks, Dr. Yazdi.
Thank you.
Bye.